Good morning, student. Today we'll see about hand fracture management. Hand fracture management optimizing patient outcome. Hand fractures are common injury, accounting for 10 to 25% of the all cases fracture. 1.5 million of emergency department visit the annually at the hand fracture. Our focus is on restoring the full hand function and preventing the long-term disability. Then epidemiology and functional impairment. What is the mainly for affected demographics? Most younger males affected the trauma cases. Then the elderly female is mostly affected the falls in elderly. Then why it is called falls in elderly? The osteoporotic fracture bones. Then you go for common fractures. The phalangeal fractures are approximately 50%, and the metacarpal fractures are approximately 30%. Then daily lives impact. There is a significant impact on daily activities, work, and overall quality of life. Then potential complications. They can lead to long-term stiffness, pain, functional deficit, or improperly managed. Then you will go for initial assessment of diagnosis. The clinical examination is mainly for swelling and deformity of the finger and wrist. Then rotation is mainly for scissoring of the finger and fisting. Then localized tenderness of the fingers and either metacarpal, phalangeal, then hand joints. Then imaging techniques mainly go for standard X-rays, posterior anterior view, lateral view, and oblique views. Then CT scan mainly for complex and intraarticular fractures and comminuted fractures. Then you go for classification is based on the location, phalanx, metacarpal, type of the spiral attached fracture, and displacement or dislocation. Then we'll go for non-surgical treatment. Other principles. The indication for the main stable fracture, non-displaced fracture with minimal angulation or dislocation. Then method is mainly for close reduction method necessary. Then it followed by appropriate splinting or casting. Then immobilization is the typically 3 to 6 weeks is the single cast. Then X-rays. Then at 1 to 2 weeks to monitor positions. Then common splint include the ulnar greater splint for 4th and 5th metacarpal phalangeal fracture, and radial fracture for the 2nd, 3rd metacarpal phalangeal fractures, and stable phalangeal fractures. Then we will go for surgical management of principles. Mainly for indication, mainly for open fracture, then significant displacement more than 2 mm. Then unacceptable angulation or malrotation. Then intra-articular step of the more than 1 mm. Then we'll go for non-reducible fractures. Then techniques will go for K-wire fixation, mainly for simple percutaneous for stable fractures. Then open reduction internal fixation, mainly for plates and screw for the comminuted fracture and undisplaced fracture or intra-articular fractures. Then primary goal is anatomical reduction and stable fixation for early rehabilitation. Then rehabilitation for restoring function, mainly for the early motion. The early motion is critical for preventing stiffness. Then often starts the 1 to 2 weeks after the post of the stable fixation. Then hand therapy is mainly essential for each certified hand therapist focusing on the recovery. Then strengthening is a gradual progression of the grip and the pinch strength exercise to regain full functions. Then modalities can include the edema control, scar management, then passive and active range of motions, then custom sprinting and specific contractures. These are mainly focuses on the hand fracture rehabilitations. Then we will go for potential complications. What are the complications in the hand fractures? First complication is the stiffness or contractures. Mainly for most common is prolonged immobilization period. Also, then next is the malunion, the healing in the deformed position leading to functional deficit. Okay, then we will go for non-union, that is a failure of the bone to heal, that is causing persistent pain. Then we will go for infection, risk to open fracture or surgical open. Then we will go for infection, is risky to open fracture, surgical intervention. Then CRPS is a closed reduction palpation is meant for rare but debilitating pain conditions. Then tendon nerve injury is from direct trauma or surgical complications. And we'll go for finally go for conclusion summary of the conditions, mainly for achieving the best result. Then we'll go for accurate diagnosis, mainly for timely and precise identification of the fracture is paramount. That is a timely and precise identification is a must important. Then we'll go for individualized treatment, the careful selection of the non-surgical or surgical approaches based on the fracture characteristics. Then we'll go for early rehabilitation. As a supervised hand therapy is crucial for restoring function and the preventing stiffness. Then we'll go for complication management, mainly for vigilant monitoring and promote the intervention for potential issues. They will go for collaborative care. There is an effective partnership between the surgeon, therapist, and partnership to the best result of the patient needs. They will go for improve the hand functions in the post-operative or post-traumatic cases. These are the hand fracture management of the. Okay, we'll go for next classes.